techniques to put in place risk mitigation for COVID-19 infection, you're going to see pretty quickly that a lot of this overlaps with the state, and you're quickly going to wonder, well, what's different about this that the state or the CDC is offering? And I'll get into that, but just off the very top here is we're proponents of getting back to work, but getting back to work safely. And we call the body of work we put together as save lives and save livelihoods. And we ask that everybody watch a 5-minute video before this. And it's really about how we define the problem and the approach we take to safety. It's not important enough to know what to do. You really need to know why you're doing it, because knowing what you're actually targeting with your mitigation gives you the confidence to do it well. And more importantly, to get your people on board with following it, not because it's the law, not because we say so, but because we have a better understanding of what the threat really is. And our body of work is based on research that's been done by others, universities, peer-reviewed research. And where it's not peer-reviewed, it's been done by people we're confident that are using scientific method. And we've really taken great pains not to include anecdotes or the next article or secondhand information from a friend's brother's nurse, wife, or anything of this nature. So why don't I get into this, and then I'll take questions as we go or at the end of the PowerPoint. And then I think it's equally important to all of these ideas is I want to at least show you the homework we have done. So this is not a blind faith type of exercise. You can then follow our work. You can look it up yourself and read it. So Kent, with that, orient me to the sharing option here. Do I need to just click a button?
I think Raina, she's the technical side on this Zoom sync. Raina, do you got that?
Okay.
Yes, so you're gonna, there should be a share button at the bottom of your screen.
Okay, there we go.
And then you can just go ahead and click that, and it should share your desktop or give you some options on what you want to share.
Okay. Okay, here we go. And I have this PowerPoint up, and just let me know if a couple of you can see it.
Yep, so it looks great.
Okay, we titled this Unmask the Mask. You all should be familiar with this because I believe the state is requiring masks for workplaces, but we really want to go into why that is so important. And what we're really putting as a subtitle is targeting COVID's delivery system and getting back to normalcy here. So what we have is the problem. If you've seen the video, and the video is not the end all, we just choose that video as a pre-work simply because it does a good graphical job of explaining the problem, is that this is a problem of a semi-airborne type of virus. It transmits, as we understand it, very similar to the flu. So it's nothing new or novel in that sense. And if you take the simple graphic here of all these people breathing around one another, they're going to put these kind of particulates. Green would be benign ones and red could be potential infected ones. If you take a simple measure like a cloth mask, a simple 2 layers of a cloth mask have shown in laboratory experiments to block up to 69% of those particles. And one of the big mindset shifts is that a mask is really not personal protective equipment, as it's often called, PPE, is a mask should really be billed as SPE, social protective equipment, because a cloth mask is 69% ability to filter particles. Well, what about the 31%? They're going to get you anyway. Even an N95 mask, the 95 denotes 95% filtering capacity at a certain micron of size. But if you spend enough time in an environment loaded with particulates, it's only a matter of time before the absolute number in that 5% will get to you. So that's the deal, is if you walk into a virus-rich environment and you don't have 100% protection, you're eventually going to have a problem. So it's flipping this around to say, what would happen to the particle load that looks like this if we could drop it like that with everyone wearing a mask? What would that do to the spread of the virus? Would it be easier for the virus to spread or harder for the virus to spread? And I love that the state is asking employers to wear a mask or requiring it, but I can't understand why in the grocery store, as of Tuesday, everyone is wearing a mask, but only 20% of the public is. We're essentially saying to those workers in the grocery store that you're wearing your PPE, but we're negating the effects of that PPE because there's enough other human beings breathing into the air. So part of what we're trying to do to educate other business owners is not only help give them tools to get back to work safely. That is our #1 priority. Our second priority is to give you information and tools that you can ask intelligent questions of policymakers and ask them what science their guidelines are based on. And thirdly, we just have kind of an altruistic mission in our general society to volunteer our time to educate people that the public going about their day in a public place without masks is really extending this problem. And there is a real problem of a coming second wave. So if this doesn't help us now, we really feel this type of information will help us in the coming months. But in any case, the #1 simple technique, and why it is #1, because it is this simple, is if you're going to be around other people, put on a mask and you take 69% of the particles out of the air. #2 is temperature testing, and you're familiar with this. But temperature testing, basically what we did is we modeled the 14-day period of COVID that's often quoted and looked at the probability of symptom onset. And this is now being revised right now. The science is not all in on the new revisions because of antibody testing showing that the asymptomatic are actually far greater than what the CDC said a month ago. They believe 20% of people being asymptomatic 1 month ago. Well, it's far greater, but we don't have a consensus on that yet, so we don't include that in the model. So based on the old model of 20% asymptomatic, of the 80% who are symptomatic, 89% of them display a fever. So it's a very reliable indicator to filter infected people out of your environment. Now, if we learn for example, New York City did antibody testing and learned that 21% of their state residents have been infected, even though the case rate is 1.5%. LA County, Santa Clara have done similar things, though their revised rate's at 5%. So we'll deal with that when we get the science. But for now, temperature testing, what we have done in our model is set a range of 19 to 48%. So we're taking the low value to be conservative, but right off the bat, when you start looking at this from a mathematics standpoint, if you can put on a mask that could give you 69% or better filtering ability into the air, and then you can filter people out by 19%, if you add 69% to 19%, you start to see the approach to 100% of risk mitigation. And we're not saying 100% is enough, but mathematically, you start to see a different picture on the described problem. So what we did at Atlas, we created sick policies to allow employees to be paid for a week if they stayed home, to give them the incentive to tell us about their symptoms, because not everybody will have a fever. And then we're doing mandatory testing, which in Washington State, I realize that's mandatory with the new rules. The third solution is called de-densify, and you often don't hear it termed this way. You often hear it termed as social distancing. For example, restaurants right now, as I understand it, those trying to get into phase 2 or phase 3 of opening back up have to submit plans to the state that show tables distanced 6 feet apart. And I'll get to social distancing in the next slide. But what de-densification is essentially, if you can thin out people any way possible, you're going to make it harder and harder for the virus to spread. The way we did this at Atlas is we found some of our small plants were working 5 days a week, 8 hours per day, pretty standard. Well, we said, why don't we split that crew in half? Why don't we have half the crew work Sunday, through Tuesday, 12 hours a day, and finish out their 4 hours in Wednesday. Have the second crew come in later Wednesday, start with their 4 hours and work 12 through Saturday. Essentially, by taking what particulates are left in the air, that 1.5 is the graphic shows you, you now deny one infected person access to 50% of the workforce. Now, depending what kind of industry or even what your industry works, this may or may not be possible to the same degree. We have, of our 16 plants that did this, we had 2 of them that got up to 50% reduction of people while keeping their paychecks whole. Everybody's still working, but they're not working at the same time. Therefore, they're not at risk of infecting one another. So again, you start layering the protection for the plant that got up to 52%, 69% with a mask, 19% with temperature testing, and add in 52%, you really start to increase your confidence. So let's get to social distancing. As we've studied this, we don't really see social distancing as a pillar or a technique to lead out front. It's our number 4. We think it should still be done. We just don't think it's the end all. And oftentimes you look at some of the policy that's being rolled out, you see social distancing put out front and center. Let me give you an example. I heard on a call last week from 2 different sources. As a window glazing window company is trying to put their people back to work, initially they were asked by the state, can you install windows and keep your people 6 feet apart? And they said, well, in many cases, yes, but if we have a 5-foot window, we need 2 people, they won't be exactly 6 feet apart. And the state representative basically said, well, then you cannot work. Now, they were able to get around that and get working, but I think if they had this information, they would be able to lodge a different type of an argument. First of all, where does 6 feet come from? 6 feet is really based on doubling an old study from the WHO done in the 30s. There's research from MIT from 2013 forward that shows that 6 feet is not adequate at dealing with the particle transmission. And when you look at the simple video, you see that the fine particles can linger for some time. To take this further, social distancing is effective, but it's only effective in a static environment. So if you're sitting in church 6 feet apart, yeah, you're doing some real good there because you don't have people moving. Let's take an example that I think everyone can appreciate. Look at the grocery store. When you stand in line at the grocery store, and I applaud the grocery stores for having taped 6 feet apart, but think about the time it takes for a transaction. Call it 3 minutes for the clerk to ring the cash register out. In 3 minutes time, a human being standing in place is going to breathe about 18.5 times per minute. And if they breathe out about 50 particles a minute, that 50 is not studied. We had to use that number as a baseline, and I can show you that math later. But in 3 minutes, you're going to breathe out something like 1,700 particles. Some of those are going to linger there. The bell rings, everybody faithfully marches forward 6 feet. Now you're standing in that person's plume that was breathing there. If they're infected, you're now taking a great risk, unmasked, at breathing that in. So social distancing is important, but again, the approach to this, the why is important. It's very hard to motivate people, particularly the public. We as business owners get it because we want to get back to work. But if you just say wear a mask and people don't adopt fast, I think they would adopt a lot faster if we showed them a video of what the actual threat is and why we're using that measure. So this is the type of information trying to make available to people so that we can logically move our way through these problems and educate ourselves and ask the right questions. So back to the glazer, if I were the window company and I was told by an authority that I couldn't work because sometimes my glazers could only be 4 or 6 feet apart, I would first say, well, we're on the outside of the building. We will have our people check to make sure we at least have a 1 mile an hour per wind. Because again, if you look at the simplicity of the video, if you're in a room where no air moving and you simply open 2 windows, Mother Nature will clear that air pretty quickly. So don't get me wrong, the mask is not the most important solution. It's just the quickest and most effective in the short term. Once you and your business can start to look at ventilation strategies, we can do a lot of good work that would not only help get us out of this pandemic, but help our workplaces be better engineered to deal with the next pandemic. So if I was the glazer, I would make sure we have natural wind. And if we were 4 feet apart, I would ask the state authority, where is the science that says that there will be a transmission at 4 feet with ventilation? And I would reference MIT, I would reference some Hong Kong University data, and I'd reference Nippon Air Technologies in Japan, and sit down with that state authority and logic our way through that. And again, I will show you the tools where that's available. And again, I'm willing to help volunteer my time. And make no mistake, I'm not here to criticize our governor or the CDC or anybody. This is not about criticism. It's about education and trying to use facts in an argument, not anecdotes and not our political ideology. So this is social distancing. We view it as an amplifier, not an initiative, and we should still keep doing it. Lastly, air circulation, which we believe to be the most powerful. It's only number 5 because every room, every environment is different. It depends on the cubic space of air. It depends on whether that air is moving. It depends on whether it's filtered or not. It depends on a lot. So there are some short-term things we can do, and there's a lot of long-term capital investment opportunity we have as well. But implementing simple air movement is essentially taking things and moving them out. So really, when you start looking at trying to engineer the work environment, again, social distancing shouldn't be the first thing we talk about. We should say, do we have adequate air ventilation? Do we have adequate air changes? And can we keep fresh air coming into that space and move particles up and out in an effective way? So this is the layering strategy. We think about masks not as PPE, as social protective equipment instead. So we block it by 40 to 69%. And we use 40 to 69 in our mathematical model simply because we know that we have to teach a workforce. We know that there is some leakage out of the sides if it doesn't fit well. We know there's sanitation issues, but those are no reasons not to do it. They're certainly not going to reduce the effectiveness down to 0. And I've had a lot of skeptics. We've done a lot of research about these things, but we've also done research looking to myth bust any of our work. And for example, I'll tell you how easy it is to bow down to an anecdote. I had a person earlier this week say, well, Doug, I hear doctors tell me that masks do more harm than good. And I said, okay, fair enough. Can you describe the harm? And the air goes quiet. Harm is an anecdote. Where is the study? Okay. The Surgeon General back in March actually went on TV and said people should not wear masks. And so, okay, good, let's look that up. There is a study for that, and that was done in 2012 or 14, I don't recall, but that they did a study on college students that found that they touched their face 23 times. So the theory was wearing a mask, they would touch it, infect it, they didn't touch everything. But were those students in a pandemic environment? Are we denying a human's ability to learn not to touch their face? I know personally it took 3 weeks. So when you start looking at any credible source, then where they get their information, it's important not only why, but how we use that information. And let's not deny us as creative, innovative business owners the ability to engineer our way out of this. And we have the science to take this logical look. So block it 40 to 69%. Test it and rest it away by 19%. I will tell you, I expect to lower that when they get a firm grasp on the asymptomatic, but we have other measures to make it up. Dedensify from 10 to 52%. We have 3 plants that were actually 0, and that's because they're 24/7 operations already. So we have some that only got 10 or 12%, we'll take it. Separate it, that's social distancing for added amplifier. We can't put a percentage on that because there's 0 studies. We just know it's a good idea, but it's not number 1, it's number 4. And then look at your ventilation. Ventilation done well could just account for 100%, but we can't make up that number. We have to get air filtration and air technology companies into our businesses that have that expertise to study that for us. But in any case, when you have a layered strategy, you are looking at taking an airspace that might look like the picture on the left, and with worrying about 5 things rather than 30 things, take an environment and make it look like the environment on the right. And when we look at it from this perspective, we were able to solve our major problem at Atlas And we're an essential business, so we did not have to shut down. But our major problem were two things. Were one, our workforce was very scared in March. Some were questioning, why are we essential? Why don't we just stay home? And we were also concerned about the safety of our people. We have a incident rate in the industry that is less than the industry average, and we want to drive it down further. We're committed to the safety and well-being of people. So we went to work on researching this, and we came up with these measures. So at this point, I'm going to kind of show you a few things in the workbook, what the sources are, where the science comes from that backs this up. But while I shift over to the Excel sheet, I've got Bob Butkus and Josh Livingston. Are there any initial questions to us before I show you our work?
Yeah, hi, Doug. My name is Paul. I have one quick question.
Sure.
And so we obviously, the masks are a main focus. What about gloves? You know, because obviously we've got the particulates spreading throughout as people are breathing. So what have you guys found out about the use of gloves or not using gloves?
We've taken just a logic policy perspective to that. We've really not searched for any research on this. We just look at the logic of the surface itself. You know, basically, what is the difference between a human hand and a glove and its ability to hold a contaminant? And at that point, what purpose does the glove actually serve? All I know about the gloves from people that have worked in biomedical industry is anecdotal, so I don't really use it, but I'll tell you what I know. They say the only benefit they see in a glove, unless you're dealing with a caustic substance that's actually as PPE protecting that hand, or some sort of bio substance that could infect the hand, the glove does do a good job of reminding you not to touch your face. It has that effect. But otherwise, if I see at the grocery store, for a matter of observation yesterday, the grocery store workers are wearing their glove. And after each customer goes through, they're taking hand sanitizer and actually rubbing down the glove, equivalent to wiping down the hand. Now, in that sense, it might be friendlier to the human skin not to put hand sanitizer on your hand approximately 50 to 100 times per day. So that's about all I know of gloves. Is that helpful in any way?
No, absolutely. I just having my own thoughts. So I wanted to see what your thought was on it.
Certainly. Okay. And I'm just going to bring my spreadsheet up here as soon as I can find it in the list. It's not appearing here. Raina, I'm going to see if I can unshare this because my spreadsheet of choice is not showing up in Zoom's list here. Do you happen to know how I stop sharing? Here we go, stop share. All right, I'm going to relaunch this. Are there any other questions while I'm searching for my sheet here?
Okay. Have you guys done any research
I'm gonna,
on how long it stays on surfaces, like credit cards, things like that?
Yeah, that's one I've looked a lot on the public domain for information, and I really have not found a consensus on that. I've seen a wide range of things, so I really kind of abandoned trying to find some information on that. Does anyone else have a credible quote they'd like to offer on that? Okay. This spreadsheet contains all of our work. There's many hours have gone into this, and my boss, Bob Butkus, has done a lot of the work on the air ventilation part. Josh Livingston, our EHS director, environmental health and safety, has done a lot of work in general. And then we have a technical director that has assisted me in a lot of the research here. But essentially, this comes from defining the problem. And I told you at Atlas, we were really trying to quell the fear our employees had and actually get to facts rather than fear. But for this conversation, I think the current problem is facing the high economic and social cost to extended work shutdown. Would you agree with that, or would anybody see it differently? And I know everybody's on mute, so you're probably saying lots of things I cannot hear, but that's okay. The ongoing, that's the current problem, and a lot of you are going back to work, so that problem is going to be solved here because you're getting back to work. However, without solving the public's breathing into the atmosphere in spaces, I think we can be confident that a second wave is coming. And I think what you all should prepare for is what happens when the second wave comes, and will the shutdown be the weapon of choice to quell the second wave? And that does give you some time to arm yourself with information and hopefully lobby not to shut down when the second wave is, but to take a different targeted approach. And so I think these tools here are relevant for today's environment, but also for an environment that is likely to occur a couple months down the road. But the ongoing problem that really needs to be solved is the fine respiratory particles that linger in the air. And I also want to point out something in doing this research. You're going to have this lingering question, who is right and who is wrong? And the answer, I believe, is we're all wrong. So what we're proposing in our work is not a silver bullet. What we're saying is this is a body of work about right and wrong, but it's about reducing risk by accessing the information of scientists, researchers, and engineers and integrating it into a comprehensive model. So this is what we've really done. Also, I want to keep in mind, if you want to look at what the macro solutions are in society, this kind of models that. The preferred solutions we're all waiting for, option D would be some sort of antibody testing or RNA testing to actually help strategize how to stop the spread, or better yet, a vaccine. What's really being debated right now at low levels are option A, B, and C. Option A we've lived with for 6 weeks, that's shutting down, and option A could be chosen for the second wave. Option B is what we're proposed, and we just call it engineered. And we don't need it to be Atlas's system. We don't think Atlas's 5 solutions are the end all. There could be others. What we're going to show you in this spreadsheet is you can choose any solution you want, but what you want to do is look for a study, look for research that can back it up, and then assign a minimum and maximum expectation and put it into a risk model so you can approach your workplace logically. Not only for yourself, your employees, but if you're dealing with any kind of state authority and you're getting different guidance, you know what questions to ask and you know how to back up your own ideas. But option C, there is an emerging research that we're following, not recommending it, but following it, and that's the concept of herd immunity. And this is country of Sweden, if you want to follow them, has not shut down and is really trying to beat the virus by protecting the vulnerable and quarantining the vulnerable, rather than quarantining everyone. So in any case, who's right in A, B, and C? I think that is yet to be seen. But in the meantime, can we work and can we be confident we're keeping our people safe as possible? And that's what this is about. So how we got this is by using something called an A3 problem solving format. This is used in industry. If anybody is familiar with lean manufacturing movement that came from Toyota, I've been a practitioner of this for 20 years. Also, there's Six Sigma methodologies. And the main idea of this, I'm not going to have time to take you through the deep recesses of this, though I will volunteer my time for any of you to go offline and take you deep into this for anyone who's interested. But what we do is we get information about the problem, we learn about the problem before we talk about the solutions. Then we define what the current state is based on that learning, what the current state actually is. For example, the grocery store example, it's not about social distancing, it's about particle transmission and walking and breathing through it. We need to reframe the problem in society. Then we do root cause analysis. Just because something's sitting on the surface doesn't mean that's the actual problem. it would be like going to the doctor and saying, I have a sore throat. And they're like, yep, you've got throat cancer. Well, no, doctors don't do that. They dig a little deeper to the root cause. And we do the same thing in this. And we define the future and we define the actions. I'll show you what we're talking about is actually done. We're a company with 16 sites. I have 5 sites. It's moving to 7. My boss, Bob, who's on the phone, has 16 manufacturing sites. And this is an example of the 5 countermeasures we've designed. And this is an example of my actual plants and their percentages, and how I can see in the aggregate here, how I have one plant that's reached 113%, 2 at 93, one that's doing a great job at 131%, and one is concerning me at 80%. So I'm able to look at the plants that are not mitigated enough and work with them to help design safer methods. And what we're counting on is the air ventilation studies that we're doing are going to get us the rest of that way. But for my plant at 113% and 131%, I at least feel pretty confident that we're doing better than the public and better than the average at keeping people safe in the work. And I can explain it to my workforce in empirical terms rather than just authority terms. So I'm going to go fast here so I can wrap this up, leave it for questions and not take too much of your time today. Basically what we do in our model is we rank the solutions. We assign a minimum and maximum value that's based on the research. And then what we have done is define the particle load. And I got to go quick, I'm sorry for that. But basically we modeled what is the particle load for sneezes, coughs, loud talking, normal talking, and breathing in an unmasked environment. The top 3 come from research. For example, loud talking is shown through research to emit 3,000 particles. I believe that's in a minute. And for normal talking and breathing, there is no research. So we had to plug the numbers in yellow. It doesn't matter what the particles are. What matters is what % you can reduce them. But we included breathing in the model simply because we breathe a lot. 5 sneezes from 5 people are going to emit 22 million particles into the air. And how long they linger depends on your environment. But keep in mind, if 50 people in an environment, this is what this is modeled on, but if 50 people are breathing at 18 breaths per minute all day long, that's 23 million particles. That's equivalent to 5 people sneezing unchecked 5 times per day. Okay, what we said is, what if 10% of the people were infected? That would give us 4.9 million particles to worry about. And again, is it 50 million particles at 100 million? We can't know that. This is a model, and the model is clearly going to be wrong. What's going to be right is the mitigation. And so what we did is establish min, max, and we took the midpoint for face masks, de-densifying, and social distancing. We took the low point for temperature testing because I think the asymptomatic is going to show that temperature testing is not as powerful than we think it is, but we still shouldn't stop doing it, even if it dropped to 5%. And then improves air circulation. We assigned 25 to 75% as a guideline. We had to make those parameters up there, but again, when you see the fine particle transmission and how simple air moves it along, you logically know that that's going to be a big part of the solution. Nonetheless, because we have more work to do, we assigned a low value. And the idea is you layer these. If wearing a face mask can pull out 2.6 million or you're 4.9, you're halfway there. If you stack temperature testing, you're at 75%. You stack de-densification, you're at 100%. Don't stop, keep going. You get to 110%, maybe with more social distancing. And again, we've used a very conservative 15%. And then with air technology, 135%. Every plant we have, every business of yours will look different, but this gives you the methodology to model it, to give you a sense, are we taking great risk? Or has the risk that's been reduced, can we feel confident we're doing good here? And do we now have valuable information to talk with legislators or policymakers and ask them questions about their research and to tell them about our research and how we know it and what we're doing? It really changes the game of how conversations go on this topic. So with that, I'm just going to point the references. I'm not going to have time to deep dive them. Everything about a mask is on this page. Everything in pink is not vetted. Anything in white has been vetted. So, for example, I'm very interested in this. I haven't vetted it, but this is a lab that has taken all the materials for do-it-yourself masks and test them down to 1 micron. I'm very encouraged that the one that I wear, which is a Scott's blue towel cloth, can filter 87%, better than the 69% in the initial study. But this is all here for you to look at. And again, if you don't want to read it all, feel free to give me a call and I'm happy to orient you and get you there faster. The China bus, I want to stop here for a second. This is a study in China, and this was done in January, and the Chinese government, being a communist dictatorship, can do things that we don't do in the US, but they have video camera in all their buses. And this is a study of one COVID-infected patient called patient A, who's in the red there, on a 4.5-hour bus ride. And in 4.5 hours, he managed to infect 8 or 9 other people. What's interesting about this is a couple things. Notice that 4.5 meters, or about 12 feet forward, are 3 people that were infected. But notice the 3 people next to him in front of patient A are not infected. Well, what they figure is the fine particles he was breathing, because he was not wearing a mask, were going through the bus's air conditioning system and carrying the particles throughout the bus. Something you have to look at in your workplace air filtration as well. You really need to make sure you're not carrying particles to other people, that you're filtering them. But in any case, back to the bus, the blue person was asymptomatic. So they tested all these people and, learned their actual status. The person in the pink there, this one is interesting, and this really lends credence to the MIT study and Nippon Air's study with the video you saw, is that this bus disembarked after 4.5 hours, stood idle for 30 minutes, and then reboarded with the group. And the pink person had no contact with the first bus load of people, got on the second bus a half an hour later, and turned up with COVID. And they can trace that infection back to that time period they were in. So it lets you know that the lingering air particle, there is something there to give you a real world example of what that looks like. Another couple things to take away from this, the people that are in front of him and next to him that were not infected, and the research doesn't give you every gray person's status on there, but it does give you this. It does say that everyone on this bus wearing a mask did not get infected. Only people who were not wearing a mask. But additionally, what you should point out here logically is not everyone not wearing a mask was infected. And that lets you have one peace of mind. It lets you know that the coronavirus is not an omnipotent monster. If it were, it would have infected everyone on a bus ride for 4.5 hours, and it did not. So it lets you know that, yes, it's a bad thing, but we don't need to be fearful of it. We need to be smart with it. We need to use our brains, our innovation, learn everything we can from credible sources, and then put that to work in our workplaces. So in any case, this is how we modeled the temperature testing. We just looked at the 14-day period and looked at where fever's onset, et cetera. These are actual atlases de-densification by plant. You can look at this. You can ask us questions later if you want. Social distancing really talks about what we see as social distancing. It works when people are static. If people are moving, you're negating the effects of social distancing. It's not about space, it's about particles. And we can't stress enough that we need to reframe the problem as particle transmission and not space. Space just makes it better. But if you don't address the particles, you're going to walk through the particles. And then lastly, the air technologies. And I've talked enough on here. I want to let my boss give this one anecdote. Bob, would you mind just contrasting? You don't have to take us through the sheet, but these two different pieces about the particle load and the number of people.
Yeah, just real quick. If you have 2 people in a 15-foot by 15-foot by 8-foot office working together with minimum ventilation, that is 5 times more dangerous than having 50 people in a 100 by 100 by 20-foot space. So the smaller the space, without air movement is a problem. And this is all we're trying to do is modeling here is a little bit of air movement, spreading people out in big spaces is more important. And then on your small offices and your air conditioning systems, make sure you have decent filtration. The 3M website for Filtrite is really good. They have a rating for filters called a MERV rating, and I want to say 12 or higher should be catching viruses. And you need to be running the air conditioning and furnaces in your buildings. In my opinion, you should run them 24/7 just to be circulating air, to be moving air constantly. So you could be turning air over, as that video showed, which was very shocking, is just opening 2 windows, how quick those air particles move out. So fresh air and movement of air is, in my opinion, much more important in our offices and in our buildings and that. So thank you.
Good. Thank you, Bob. So with that, there's some other sheets in here. Basically, if you decide to follow our work, just follow all the blue bubbles, going back to the intro tab. And if you just read the blue bubbles, it'll tell you what to go through next. The sheet's pretty logically laid out. Every one of these are kind of referenced to walk you through it, because nobody has the 300 hours to probably read all of these studies. I would also invite any of you to improve our work. We don't think we're the smartest people in the world. We just wanted to not lay back passively and just wait. We wanted to get active and see what it takes to get Americans back to work. That's really what motivated us. But this is kind of the PowerPoint presentation. So the PowerPoint does a good job for lay people who don't care about the research so much. So if your people trust you, you can kind of show your people what the threat is and how you're dealing with it. This really helps dispel fear. And at the end of the day, our motivation when I come back to this intro, like even coming to this call, we want no credit for this. This is all public domain. We didn't invent the research. All we did is invent the risk model. And that's just trying to take other people's research and look for other sources and vet it. And what we're really trying to do is spread the word, and we want to do it in an educational way. We mean no critique to our government or other things. They've got their hands full. They're learning like everyone else. But we're also, what I see in this journey is I see 3 emotions to manage as business people. One is fear, and to that I say don't fear, act. And number 2 is apathy. Don't wait for the government because they have their hands full. Get involved. Our economy depends on it. And number 3 is overconfidence. Saying this is no big deal on an event that hasn't happened in 4 generations, it is a big deal, and we need to act like it as Americans. So we just need to act on it in a respectful way, and luckily we're seeing a lot of respect right now, but try to spread the word and educate others. And where you get people trying to stop you from educating yourself, ask them questions back. When someone says that they know a doctor that says this is bad, ask them to define the bad. Ask them to cite the research, and then go look it up for yourselves, or maybe throw it to me. I'm happy to spend my night till 1 in the morning reading anything I can on this subject. So with that, Kent and Raina, I'd like to open it up to questions or anything else you'd like to ask about this.
Thank you, Doug. Yeah, and if there are any questions that anybody might have, please ask one. Are there any other questions?
Okay. Yeah. Well, I couldn't possibly have done such a good job that satisfied all your questions, because again, I don't think we're that smart, but I can ask you all a question. Is this information helpful to you in any way?
Yes, Doug, I think we could take this back to our groups of people and explain to them. It gives them a little bit better idea of why they're doing what they're doing. So I appreciate that. There's a lot of good information here.
Okay, well, good. Thank you.
So if you have doctors that are saying that we don't need to have this, that we need to get out there, we need to get, you know, out there amongst everybody, kind of that herd mentality. And why is this way better? Do you think this is better than doing it the way that other people are saying to do it?
Oh, that's a great question. I won't dispute that herd immunity may not be the way to go. I just don't know that there's a political will to do it. And here is why. I can make this really quick. This model's Sweden versus Norway. They're two countries right next door to each other. One country has shut down, the other has not. And the death rate in Sweden is definitely higher. But essentially, if you imposed Sweden's mortality rate onto Norway, you would end up with 1,267 more dead people than if you were shut down. So the problem the government has there is they have to answer to those 1,267 families. And that's why I say there's not a lot of political will right now. But I will also say this, we will learn a lot more about what the second wave looks like. And if Sweden right now, when I look up their revised case rate, the Swedes have up to 10% of their population that haven't been infected. Now, there's a doctor's video went around that said 21%, but when I looked up his data 2 weeks later, they have more data, it's actually 10. But Norway is running at about 3.8%. So at some point, there's going to be a tipping point mathematically with Norway, whereby they have enough herd immunity that makes it just hard for that virus to spread. So once we see the second wave, we're going to know whether Sweden experiences a second wave or whether only Norway does and that death rate catches up. Then the political will to do that, I think, will be there. But we don't have enough information right now for anyone to take that leap of faith and that risk. And Michelle, does that help answer that question?
Well, yeah, because I mean, I know that like we have some states in this country, like South Dakota, they didn't shut down at all. They did it the same way. So do we have, will we have good studies that will show the difference of how that state compares to, like, say, Utah semi shut down, but didn't do a complete shutdown?
Yeah, the answer to that question is there's no studies that prove it right now. And this is really what motivates me to make this statement about anything we do, is we have to be very comfortable with being wrong. None of us should say we've got it all figured out. Right. And that's why in our risk model, we use midpoints and low points, as we really try to be conservative. So if we can get over 100% and we're conservative, we're building a margin of safety. But again, that is something to watch. And absolutely, I'm watching it. So great question. Thank you. All right. Any other questions?
So just out of curious, Doug, so it's funny, Kent and I were talking about this yesterday, and just being out, you know, not seeing people wearing masks. So inside your model, and maybe I missed it, does it show for a certain area or population if we are actually wearing our masks and how much that actually reduces our exposure? Did I miss that part of the modeling? Or do you guys have numbers?
No, that's a great question. And I don't know if there's enough data available to actually make that correlation. Our EHS director and the data our EHS director captures, I've asked, can we pull in data from the states that have mandatory masks and the counties in California and Oklahoma that have those, and watch them over time and see if does their curve drop faster than others. And then also what would need to be done is for me to contact people in those locations and actually have them random sample and say, even though it's mandatory, do you have 100% compliance with that, or you still have something lower? So, you know, when you do statistical research like that, there's an old phrase that say correlation does not imply causation, and you have to be careful with data sets. So right now, there's not enough information to draw that correlation.
Right, you know, and it's interesting, right? Because like for me, we're up here in Washington, and to me, it seemed like a no-brainer where if you're going to leave the house, you're wearing a mask. And it seems like that any store that's opening should require a mask to come into their store. And I wonder how long it's going to be, and I wonder if Washington has that in their stages for opening up the state. Because I think if you were to open up the state, I think people could go back to work. If we were wearing our masks just by the data that you guys have put together, right? I think it shows that we could significantly reduce the curve. So I look at the big signs on the highway where it says stay home and stay healthy. It should be like, if you need to leave home, wear your mask, right? So I just was curious if you guys had, if there was any areas yet. So it'll be interesting to see that data as it comes in.
No, I agree with that statement wholeheartedly. And that's my motivation for trying to network with all of you. I would really like an audience with task force members with the state. I would really like to ask them questions about their science and ask questions about the science I see and see how they studied it. But, you know, the problem is we try to keep this factual and logical and not emotional, but you can ask one emotional question that gets people there pretty quick. If you were to put your daughter on this bus ride for 4.5 hours, would you put a mask on your daughter or tell her it's no big deal? What would you do?
Oh, my kid would have a mask on, just like I would.
Okay, but it's like going back
Absolutely.
to this bus, going back to this bus thing. So did they have to track these people after this to find out if they got the virus? Because it's supposed to be a 72-hour incubation period, yet they're saying after 4.5 hours they know that these people got this. How do they know that?
Well,
See,
because here,
I second guess everything. So
well, the reason, you know, and a good
No, that's
question,
great question.
Oh, good. You know, part of the reason with them
Yeah,
being a communist country is that they're, what do you call it? Which is a big question now over here for civil liberties for us, is they're talking about facial recognition software. So with the cameras on those buses and facial recognition software and figuring out who's who and who wore a mask, that's how they're tracking that kind
but
of
I get what you're saying, but they're saying that they got this in 4.5 hours. But there's a 72-hour incubation period. So how do they know that they got this in 4.5 hours? How do they know that these people got sick unless they continue to track them afterwards? And that is something I hope never happens in the US, but I'm just saying that.
And Michelle, there's some additional information. The incubation period can span from 1 to 14 days. It displays differently in different people. The other thing is they contact traced them. So when they looked at patient A, they had all of these people tested, and then they also contact traced all those people. So they're able to see if the person in the pink had multiple different types of contacts, they might be able to rule that out. But in any case, when you read the study, there still are lingering questions I have. And I just want to impress on everyone, Michelle, I like how you question everything. In fact, I think we need to do more of that with everything. How do we know that? And where did we get it from? And so if we can't answer that, then we ought to be able to let competing ideas come in there as well. So, thank you.
I agree. I think we should question everything. Just don't accept
Agreed.
everything being told to us like the government.
If I were to work on this again, I'd want you on my team.
Okay.
All right. Well, good. Any other great questions?
I have a pretty simple one. You're talking about the N95 masks, and I know not everybody has access to those. We were pretty lucky. We secured a box of N95 early on. I have a 6-year-old daughter, and I bought, a cute little cloth mask from a friend of mine that she was sewing these. I know these are not as effective, but is there anything that I could do in addition to this that would be effective, like an N95?
Absolutely. Even though we haven't vetted this, you can be confident. Even your doctor might tell you this. My doctor told me this yesterday, but on here, access this table. I'm going to I've got a couple other studies I need to drop in here, and I'm going to these are not peer reviewed, where the things on the left are peer reviewed, but they're done by a credible lab. So if you have a mask and you can access between the layers, is take a paper towel or a coffee filter and layer it in there. There's a lot of evidence that using multiple layers of different materials multiplies the effectiveness because they are different. So, and I use the Scott's Blue Towel, which is rated at 87%. But really, if I want more protection, like if I were to go into when malls open and I were going to a store, I might just put a coffee filter in between the 2 layers of the blue towel. And then at that point, I'm stacking those and I'm getting up close to 95%.
Okay, thanks.
So look at this, and you can even look at your material and probably find it in here and see where it's at. All right, great question. Any others before we wrap up? We got 1 minute. All right. Kent or Raina, anything you want to do to wrap up?
I just wanted to say thank you so much, Doug, for taking the time, and the others on your team for making this available for all of us. And again, it is recorded, so if you need to share it with anybody, any others that are in a position where they want to talk to their staff, anybody in their maybe possible community, their connections they have out there, please reference this, or you could probably talk to Doug and get some more information. He does this nationwide, so we appreciate him taking some time out of his busy schedule to share all this, just a ton of information and all the time and effort that's gone into it. We appreciate him for sharing that with all of us. Thanks again, everybody, for taking the time out of your busy schedules to get online with this forum and participating. It's great that we can all, hopefully get back to work and be safe and just continue on and get business back to rolling where it was.
Yeah, thank you, Doug.
Excellent. Thank you all. Thank you for the opportunity.
Thanks, guys.
Have a great day. Stay safe.
Thank you.
Stay safe, team.